After I graduated from university, I worked as an animal doctor in Osaka, treating sick and injured animals, such as dogs, cats, and many others. That was 3 years ago? No, actually, it's already more than 20 years ago. I saw firsthand how deeply people love their pets. I still can't forget this time when an owner, a lady, looked me in the eye and said, "This cat is more important to me than my own child. Save her, sensei." It was in moments like those that I understood something. Animals are not just living creatures. They are family, our friends, individuals with emotions. So after working as a veterinarian for 3 years, I decided to pursue a passion in research in Nagoya University Graduate School of Medicine. Having previously cared for animals, I found myself in a complex position. Because in medical research, I had to sacrifice animals for the well-being of humans. At one point, I learned that technology replicating for organ functions was advancing. It was called organ on a chip. I thought, this will make a difference. I instinctively knew that this technology had a transformative power. That's why I chose to study at Harvard Medical School, a pioneer in medical organ chip research, to learn about this groundbreaking technology. The goal of organ chip research is to replicate the function of human organs, such as the heart and lungs, and to model diseases like diabetes and Alzheimer's in these chips. By recreating disease conditions in a controlled environment, we can develop better, safer, and more effective drugs. You may know that the painkillers and anti-cancer drugs have individual differences in their effects. With personalized organ chips that reflect a person's unique biology, we can test drugs in advance and determine which medications will work best for you. No one wants to suffer from the side effects of anti-cancer drugs. If you knew which drug had fewer side effects and was more effective for you, wouldn't you want to use that drug? This could be the future of precision medicine. For hundreds of years, medical science has relied on animals to understand human diseases and develop treatments. Mice, rabbits, dogs, and even primates have been used as model for human biology. And while this has led to many breakthroughs, there is an undeniable truth. Animals are not humans. Their physiology is different. Their metabolism is different. They experience diseases differently. Do you know your own heart rate? If you do, please raise your hand. Thank you. Okay. So now, does anyone know the heart rate of a mouse? A mouse's heart rate is around 600 beats per minute, which is about 10 times that of a human. As you can imagine, the function of the human heart and that of a mouse are very different. And so are the effects of drugs. Pharmaceutical companies develop drugs such as remdesivir for COVID-19 treatments or Loxonin for pain relief. However, a significant percentage of drugs that showed effectiveness in animal experiments are discarded before they reach the market because they are either ineffective in humans or have toxic effects. What percentage do you think that is? It's over 90%. More than 90% of drugs that were effective in animal experiments are discarded, thrown away, because they do not work in humans. This represents an enormous loss. On the other hand, it's increasingly clear that animals and humans share similarities in terms of consciousness and emotions. You may know that dolphins communicate using ultrasound, but did you know that their language has dialects? Perhaps dolphins in the Sea of Japan speak Japanese dolphin language, while those in the Caribbean have their own Caribbean dolphin language. As we are discovering, animal emotions are much closer to ours than we once thought. Every pet owner can tell you animals can express themselves quite well in different ways. How does your pet communicate its feelings to you? How can you tell it's hungry, happy, or sad? Recently, it was discovered that even ants perform surgery to help an injured comrade. For hundreds of years, humanity had no choice but to sacrifice animals for medical research. But now, we are beginning to embrace new technologies. In the last 2 decades, a new technology has emerged. Organ-on-a-chip systems, or what scientists call microphysiological systems, MPS. These are small, only a few centimeters in size, made from transparent silicone or plastics. They contain living human cells arranged to mimic the function of real organs. What makes them so powerful is that we can actually see them working under a microscope. For example, in a heart chip, we can observe the heart cells contracting, just like a beating human heart. In the lung chip, we can expose the cell to cigarette smoke and measure its toxicity, just like when a person smokes. These chips has the microfluidic channels that carries nutrient-rich liquid, just like blood vessel carry blood in our body. This setup even allows us to study immune responses by introducing white blood cells into the system. These chips are changing medicine, allowing us to recreate diseases and drug responses in ways that were never possible before. The field of MPS has seen 2 major breakthroughs that have transformed what we can do today. The invention of induced pluripotent stem cells, iPS cells, allows us to create personal organ chips that reflect a person's unique biology. This means we can now able to study drug responses and diseases in a way that's tailored to each patient. There is another important point in these breakthroughs. By allowing multiple cell types, such as blood vessel cells and organ-specific cells, to interact on the same chip, we can develop more complex, accurate model of human organs. Recently, researchers have begun linking multiple organ chips together, like liver and intestine, to replicate organ-to-organ interactions. Why is this important? Because in the body, no organ functions in isolation. The liver metabolizes drugs before they affect the heart or brain. The intestines absorbs nutrients and drugs before they reach the bloodstream. By integrating different organ chips together, we can study drug responses with the multiple organs, bringing us one step closer to replicating the full human body on a chip. This is not just an improvement in medicine. This is a revolution. Modern medicine is based on the foundation of animal testing, but this foundation is starting to crack. As human organ chips have become more advanced, they will fundamentally redefine medicine itself. Medical research will be based on human biology, not animal models. Drug testing will be more accurate and personalized. New treatments will be developed faster, saving more lives. In 20 years, I believe we will no longer have to sacrifice animals for medical research. As this technology advances, we are beginning to apply it to new and unexpected challenges. For example, my team here at Okayama University is now studying the effect of marine microplastics on the brain. We know that tiny plastic particles from the ocean are entering a food chain, but what do they do once inside our body? Organ chips are helping us find out. We are also investigating how moon dust or lunar regolith affects human lungs. As space exploration becomes more common, understanding the health risks of extraterrestrial materials will be crucial for future astronauts. One day, travel to the moon will not be a privilege only for superhuman astronauts. Then I assume that you would want to know if living on the moon was safe before you actually go there. This is the power of MPS. It allows us to study the unknown without putting human lives at risk. Some may ask, that's great, but can't we just use computers to simulate human biology? Yes and no. AI can make predictions and recognizing patterns, making predictions based on the learned information. However, biological systems are far more complex than static data sets. A multicellular organ chip system has multiple interacting cell types, such as cardiac muscle cells and vascular endothelial cells, which communicate dynamically with each other. These chips also include immune cells that respond in real time to stimuli, creating unpredictable interactions that AI models struggle to simulate accurately. When linking multiple organ chips, the complexity increases even further as inter-organ interactions influence drug metabolism, toxicity, and immune responses. AI struggles to predict these interactions because biological variability is too vast, and we do not yet have a good personal data to predict these interactions. When using personalized organ chips, patient-derived organ chips to study individual responses to drug, AI will face another major hurdle. There is not enough personalized biological data to simulate how unique individual organ functions. under specific conditions. In other words, AI doesn't know the function of your heart, your lungs, your brains, and your body. Organ chips will provide real-time functional biological responses that current AI models simply cannot replicate. AI and organ chips are not competitors. They are complementary technology that together will redefine medicine. Now we stand between the past and the future. A past where we sacrifice the animals to advance human health, and a future we no longer need to. I started as a veterinarian, caring for animals one by one. Today, as a scientist, I work toward the future where they no longer have to suffer for human progress. My dream is to create a world where people say, oh, remember when we used to sacrifice animals to develop drugs, even though humans and animals are so different? Yes. Back then, everyone took the same medicine, even though drug effects differently. It varies differently depending on the individual differences. We have the power to redefine medicine. We have the opportunity to reshape our relationship with animals. We have the choice to build a world where technology and ethics move forward together. The question is, what kind of future will we choose to build? It's all up to us. Thank you.